So welcome back, and thank you for keeping up again. Let me remind you, whenever you need architectural design, you need interior design or a project, DreamWorks Investment Company, they are the people you need, and it's one package, but with everything you need. So don't hesitate, just give them a call. So back to the question. How many times should a child visit a dentist?
Good. Visiting a dentist is very important. Even as we tell the public that everyone should visit the dentist twice a year, and then for the babies it's the same. Let the children also visit twice a year. But then nimekwama. I'm stuck on the cleaning of the teeth.
Cleaning of the
So as mothers, I'm a mother, and I know it's very difficult to supervise
and convince a child.
People you supervise the children when they do the toothbrushing because most of the time they don't even know how to do it. See, we are very busy, I know, and we are really people career maybe men like that. But then we neglect our children. That is why there is a lot of problem because they don't know how to clean, they don't know how to do it, and they don't know even how to put the paste and all that, and then we let them just do their thing. That is where the problem comes in. So they should brush every day, like after breakfast and before they go to bed. That is the time they should brush, because we don't tell them carry the toothbrushes at school. No, you only tell them when you eat, please rinse your mouth. Yes, especially if you eat snacks, if you eat tea. Drink tea in the school, and maybe you eat bread, you should also rinse them out, because you cannot tell them carry the toothbrush to school. It's very illogical.
Speaking of eating, can you tell us the perfect diet? Okay, hakuna perfect diet, but a guiding diet for children.
There is a perfect diet.
There is a perfect diet for children. Yes. Oh my God.
There is perfect diet for children, and basically the diet for children is different from the diet for another.
Oh, okay.
Because the children, they will need a lot of minerals, especially for the teeth. And you find that a person like you now, you don't need as much calcium as the baby,
because they are growing.
Because the baby needs the calcium for calcification of the bones and also for the teeth. And you find that if the tooth is less calcified, it is prone for the dental caries and all the other diseases and all that. And there is a disease I also forgot. I also forgot something we call gingivitis, bleeding gums, halitosis. Babies have a lot of halitosis. He wakes up in the morning, or she wakes up in the morning, and you like, you smelling, and like that halitosis. And also we have periodontal diseases. Yes, the inflammation of diseases of the periodontium. Periodontiums are those. Periodontium is those tissues that support the hand tissue. Okay. Like the gum, the flora bone, and all that. Yes, we also have PDL and all that. Okay. So we are talking about the diet. Diet is very important for the babies. One, because they help grow grow the dental tissues, like calcium and phosphorus is very important. So basically, diet affects the baby teeth or the baby oral cavity negatively and positively. So negatively is they should consume balanced diets. And those diets are full of calcium. And that is why in some points, we in the clinic, we tell them we do something we call fluoride application. We also do something we call fissure sealants. Yes, the first molar tooth. That is number 6. When it is out, it has some fissures, deep fissures. When the tooth grows, it has some lines, zile lines unaonanga pale. Yes, they are called fissures. Those ones are very important to maybe cover them, because they enter some sugars, and it's very difficult for the baby to clean them. So you find that in some cases, they will throw some acids, and they will start now decalcifying. And that is why we find that number 6 or tooth number 6 is the first molar in the mouth. It grows when the baby is in 6 years. Yes, 6 years. The first molar tooth, permanent tooth, is in the mouth. So this time, this baby does not know how to clean well and all that. So basically, diet in essence, it will be positively affect the
The
baby
baby
teeth.
teeth.
Now, positively, not positively, negatively, it will find us if you give them just the way we are talking about dental caries. When you give them sugar diet, it's also very bad. Every time she is taking a lot of sugar and all that. So I have basically explained why you are not allowed to give sugars to babies and all that because they are the ones that calcify.
Actually, you find some parents are a bit ignorant when it comes to that. Juu unasema ni baby teeth zitatoka. Ni baby teeth zitatoka. Can you maybe educate them on that?
At the baby teeth, kama
Like,
zitatoka.
like they don't mind.
Just the way we grow. Just the way we grow. Different children have different growing
Rates.
Just like we are, let's say we are age mates. I might be taller than you depending on my genetic calibration and all that. So back then, there are some babies who have their first teeth in 4 months. Others they will delay up to 8 months without even the first baby tooth and all that. And now the mother starts now worrying, panicking and worrying what is happening when I give birth to a baby with the dentures and all that. So basically we say that varying ages, that's the way. Others they will go to school at 5, others will go to school at 11, like that. Yes, that is how also the baby teeth grows. And even the way they shed, I always tell my patients that they come complaining. So I encourage them, please let them be shaky. Don't do any tooth that is not shaky because when you do so many at the same time, it's also a problem because every tooth they can grow anywhere. Even canine can be growing a place where the first incisor can grow. So that is why we say wait until the tooth is shaking. Completely shaking. Even if it grows kind of upper, then let it just grow and let it just remove it because these tooth, the primary teeth, they keep space for the secondary teeth. Because if they are not keeping the space, if you extract it before their time, another tooth can grow there. And then it will finish the space for the other. That is why we have other teeth now mixing. And we have now malalignment, displacement, supranumerary.
Wow, that is very important.
Yes, it's very important for the community.
Unapatanga.
More time.
Unapatanga some parents like wako zile hapana mtoe zote ndozi.
Yes, that is very wrong. It's very wrong even for the dentists who are practicing. I have seen my colleagues do that. It's very, very wrong. Very wrong. Please let the tooth first of all shake because it's maintaining the space for the next predecessor is in the permanent.
Can you discuss the impact of maybe poor health hygiene on a child?
Yes, poor hygiene, it will bring a lot of problems that started from the diseases that I have started, like dental caries and also halitosis. Periodontal diseases at that age is very bad because you find that periodontal diseases will affect the gum, the periodontal ligaments. Those are the ones that hold the tooth to the alveolar bone. So the alveolar bone is where the tooth is inserted or grows from. So there are these threads which hold the tooth on the alveolar bone. So when you have periodontal diseases, you find that these PDL, they get worn out and the tooth becomes loose and can fall the hold. And that is why the tooth is shed.
So, can you please advise our parents how effective or the strategies they can follow to ensure that their child's health is boosted and their dental is perfect?
The strategies that they can use is number one, they should face it. Even if the baby is not sick, number one, please face it the dentist. Let your dentist see the baby's teeth. Let them establish the diseases that can occur very early because some people, they wait until the baby is swollen. Yes, that is the time that you rush into the hospital. You're waiting until the baby cannot even chew because has a painful tooth, has a hole on the tooth. They wait until the oral thrush is there. So that is why we say every now and then, please rush to the dentist. It's not a lot of money for consultation. Physically, you can come even to level 5. It's free if you have the insurance and all that. So you can come to see your baby, and we can able to diagnose the dental diseases even before they thrive. Yes.
Speaking of maybe visiting the dentist, what if someone wanted to talk to you directly? Is it possible?
Yes, it's very possible. Please call me, even visit me anywhere, even in my house. Please visit me for your baby's teeth. I'm here for the public, I work for the community. I love the community. Please call me. My number 0724 3758. It will be written there. Please call me. I will face you particularly and rightly. Yes, on how to do the teeth. And I am very passionate on the babies. Yes. I don't know why I did not do pediatric dentist, but I did others. So please let them, for babies, I'm very serious. There is another condition for the community.
Okay.
When teething, when the first teeth are coming out, there is this condition, a baby starts now diarrheaing, vomiting, and all that. And they say, oh, do what? It is not teeth. People, public say it's like this. When the baby becomes the first tooth, it's very irritating in the mouth. So, and this baby is not maintaining the hygiene. So, Anna crawling, is collecting all the dirt. Your shoes, you have not even removed them. You have been all over town collecting the dirt and all the bacteria. Then they come with the shoes in the house. Therefore, your baby is there crawling, and it picks the microorganisms and all that bacteria, virus, all those. So when the teeth are irritating, you start now scratching. What are you doing? So the baby is getting infection in the GIT. Therefore, the baby will very soon become sick. He'll have diarrhea. He'll be vomiting and all that. So do you know what the public do? Very bad. They rush this baby to which doctors or which doctors? The ones that remove the first teeth. Oh. Yes, I've heard that in Ukamani and all that. So they remove the baby teeth, the ones that they're supposed to grow.
Oh, okay.
Yes, that is wrong. They should come to the hospital.
Yes. I think that is an amazing session, and I am so glad you came here today. I think, hey, we will have a better visit. Do you know it's a holiday and we have the children all over.
Yes.
So I think I'll host you again. We need to learn more and understand more.
Yes.
Very important. Thank you for keeping up. I hope you have enjoyed the show and you have learned a lot, just like I have learned. Thank you again. So see you next time on the Health Hub Show. But before I go again, don't invest on the wrong company or the wrong people. If you have that dream of a mansion or maybe rentals or an office, yes, DreamWorks Investment Limited Company, they are here for you and they are the people you need from the first step to the last step. Again, the contact is just below. Give them a call. I'm Nyambura Kamau.